You're listening to All the Pieces, a podcast created to keep you informed and to highlight the great things we have going on at Mosaic and in the communities we serve. Let's take a look at all the amazing pieces here at Mosaic that together make us great. Now here's your host, Chief Quality Officer, Dr. Karan Mohan.
Good afternoon and welcome to another episode of All the Pieces podcast. I'm your host, Dr. Karan Mohan, your Chief Quality Officer and hospitalist. Today, we'll be talking about just culture in our final segment about what it means to us and our organization. And I'm very excited to continue that discussion with our guest today, our CEO, Mike Poore. Welcome, Mike.
Thank you.
Yeah. So, Mike, before we get into just culture and what it means to us, give us a little background on yourself and what brought you to Mosaic.
Well, I've been in healthcare my whole career. Actually started my career in a small rural hospital in South Georgia when I was 22 years old. And throughout my career, I've been to large teaching hospitals, large community hospitals. One of the hospitals was a 1,000-bed hospital.
Wow.
I've worked in Catholic healthcare. I've worked in for-profit. And during my time in for-profit, I had 5 states and 22 hospitals during that time. So, but I've seen a little bit in healthcare all over.
Just a little?
Yeah, just a little bit after 35 years. When I came to Mosaic, I was actually surprised at the depth and breadth of services that we had at a hospital. In a town of 76,000 people, you don't see the kind of services that we have at Mosaic. So we're very fortunate here. And so I felt like I could make a difference. And this is my last stop in my career. And I'm excited about our future as Mosaic.
We are very excited to have you, and thank you for that experience that you bring to the table. So one of the questions I always ask our guests is, do you listen to podcasts? Are you a big podcast listener?
Well, I'm not a big podcast listener. My wife is, Penny, and so she'll send me one every once in a while and says, this is what you need to listen to. And I do, and I enjoy doing it. But a lot of times I just don't have the time to search out ones that I have interest in.
Absolutely, and there's so many podcasts now, it's hard to keep up with what's the flavor of the month in terms of popularity. But I'll tell you, All the Pieces is going to be the next on your listening list, so thank you for that. So as you know, Mike, Just Culture is not a new tool that Mosaic is using, but rather we are recommitting ourselves to Just Culture and ensuring that all our caregivers are aware of this practice. Can you elaborate on your experiencing on utilizing this tool and how it can positively impact the culture?
Well, bringing Just Culture to the forefront is a piece of a strong safety culture program of any healthcare organization. An organization has to have the accountability to ensure that caregivers have the systems designed that will give the safest patient care and the best patient care in an organization. An environment that promotes safe and supportive atmosphere provides the tools that our caregivers need to be able to give the best care possible.
I couldn't agree with you more, Mike. Just Culture is not just a tool, but it's also a shared accountability structure within the organization. We are responsible for the systems we create, and the caregivers are responsible for the behavior within that system. So I think we have just as much accountability baked in from a leadership perspective as the caregivers do to making sure our patients are having a safe and consistent experience here. So, speaking of Just Culture and how other organizations use it, there was one case that comes to my mind, and that was the nurse at Vanderbilt Hospital. This was in Nashville that unfortunately led to a patient death. Can you speak about that experience or that event and how you viewed it as a CEO of a healthcare organization?
Well, first and foremost, it was a tragic event. Losing a patient through a medical error is always a tragic event. Mm-hmm. Unfortunately, the way the event was handled made it even more tragic. I don't believe, and of course I wasn't in that situation, but I don't believe for a minute that the caregiver, the nurse, intended to harm a patient. None of us ever do. Right. Did she run through some stop signs? Yes. Should, in a just culture situation, should she have been disciplined and maybe even terminated? Maybe. But to be convicted as a criminal makes no sense whatsoever. We need to learn from every one of these things. And if it's a system problem, a process problem, a people problem, an education problem, we need to learn from that. All of those are the tools that we need to do to make sure that doing the right thing is easy and doing the wrong thing is hard. And so we've been very concerned about this as an organization. And one of the things that I ask our legal team to be able to do is what could we do to support our staff members? Because this has really put a wet blanket on clinicians across the country, and a concern where people are worried that not only do you have a bad outcome, but that then you get drug into a court and your life is completely changed. We don't want that to ever happen to our caregivers and our providers in this organization. So I was able to talk with our legal team. We came up with a policy and a process that we will actually support our team members with up to $100,000 in cost for defense of a situation that happens in our hospital without malice, without intent, and we will support their defense to that. We'll even help get a defense lawyer. But beyond that, we've actually also gone out to the local prosecutors in each of our communities and had the discussion with them about the case. And as you can imagine, most of them didn't have any familiarity with the case because they're not in healthcare, and it wasn't in our state. It was in Tennessee. But having that discussion and having them understand the circumstances around that, we got a much better understanding of how our local prosecutors would approach this, and it's not something that they would normally pick up on, and that's good because we've had that proactive discussion with local prosecutors as far as that's involved. But you never know, right. And so we have this little insurance for our staff member. No matter where you work in our organization, we will support you up to that $100,000 mark for defense.
That is very commendable to make sure that our caregivers are not only backed by the organization, but they also feel psychologically safe, that they can practice their work, their life's calling at Mosaic. So I thank the team, and kudos to you for allowing that to happen, because our caregivers can be rest assured that their team is looking out for them.
Sure.
So Mosaic certainly, does care about its caregivers, and we talk a lot about just culture as we have in the last few episodes, but this also leads to a culture of safety. Would you describe to the audience what a culture of safety means to you?
Well, the way I do it, and I may oversimplify it, but a culture of safety is a culture of accountability. And when I talk about accountability, I talk about 200% accountability. Not only am I accountable for myself, I'm also accountable for you. Now, many times our caregivers will, take a statement like that and say, well, does that mean, everybody's looking over my shoulder? And the answer is no. It means everybody has your back. And that's really what we want in 200% accountability. I'm very passionate about this. I have personal reasons to be passionate about it, but also I've been in healthcare for many, many years, and I've seen where we've made mistakes. And I always want to make sure that we're providing a environment that allows to give the best and safest care possible.
Absolutely. And I think no one will disagree that a patient's safety is paramount to any clinician. We always want to assure that every patient leaves the hospital better than they came in. So I really think that's a commendable thought. You alluded earlier, Mike, that you had a personal story, and I remember when you first came to Mosaic, you shared it. It was regarding your son. Do you think you want to share that again today with us?
Absolutely. I actually share this in every orientation, every 2 weeks with all of the new employees that are coming in, and anybody that'll stand still for just a few minutes. I tell my story. I have a 31-year-old son who was born with hydrocephalus. It's a brain disorder, a birth defect that he has, and it requires him to have many surgeries. He had his first shunt put in, surgery to his brain at 3 days old, and he's had 25 or 30 of those surgeries in his lifetime. It was a surprise to us when he was born with this birth defect, and we had to learn how to manage that with his care. But it has also been a blessing in that it has given me the perspective of the patient on the other side of the bed, because I'm the patient's family. He was young most of this time, and he needed us to be there to advocate for him. So on 2 different occasions, I have witnessed misadventures or mistakes that have happened with his care. And one of those mistakes was he had had so many surgeries that he actually had to have a central line put in because they couldn't get an IV into a peripheral line. And a nurse comes in with a syringe and says, "I've got your son's medication." Well, it's a nurse I haven't seen, and we've been in the hospital for more than a week now. And I'm not clinical, so I wouldn't know what that medication was, but I knew that it did not look like the medication that he had been getting while we were in the hospital. So I questioned the nurse. I said, "That doesn't look like what he's getting." And she told me, "Oh yeah, yes sir. That's his medication." She puts it in the central line and leaves. Well, about 5 minutes later, the nurse manager comes in and she says, "Mr. Poore, I have to tell you that your son got a medication that was intended for another child." And my heart dropped. Now, fortunately, we were blessed in that the medication was an antibiotic for a smaller child, so in essence, it was harmless to him. But any clinician knows that if it was anything other than that, it could have been instantly deadly or debilitating for him. So, the 5 rights of medication administration hit very close to home for me. On another instance, he came into the hospital, had a shunt surgery, and he got an infection, a shunt infection, which is a very serious infection with somebody that has a VP shunt. And he had to go through an externalized shunt and a long period of antibiotics. And, we could have lost him during that because it's a very serious infection. Or he could have been debilitated for the rest of his life. Now, fortunately, he recovered from that also. But somewhere, somehow, the hospital failed my son. If it was cleaning the instruments to make sure that they were sterile, or if it was sterile technique in the OR, for me, I don't care. My son came in without an infection, and now my son has this infection that could kill him. And my point with that is every job is important in the organization toward the safety of our patients' care. And so what I tell every employee is they have my authority as CEO of the organization to stop and ask clarifying questions. I believe that's part of the just culture. I believe that's a culture of safety, that no matter who you are, if you're in housekeeping and you happen to be in a room and they're giving medication administration and you see that they're not doing the 5 rights of medication administration, then ask a question. You have my authority to do that. And I don't care if it's the #1 surgeon in the world. Every time before we do a procedure in this hospital, we'll have a timeout to make sure that we're doing all of the right things for that patient. And I'm adamant about that. I am very passionate about that we are going to do the right things to make sure that our patients get the safest care.
Wow. Thank you for that. It's such a powerful story, and I've listened to it multiple times, but every time you say it, as a father, I can just resonate to my core if I would have the same level of patience as you did, but I probably would not. But the more important thing and the message of that is, first of all, that it's a learning thing, right? Everybody makes mistakes. It's a human thing, but do you learn from it? A good organization, a just organization, learns from its mistakes. To say that we are free of all mistakes and any harm we're doing it's going to be not true, because things happen all the time that you don't intend to. But as long as we're improving ourselves and learning from it, that makes us a just culture. And thank you for sharing that perspective on the culture of safety, because I think a caregiver listening to that will feel strongly empowered to stop any part of the line, if you will, to make sure the patient's outcomes and safety is paramount. So with that, we'd like to wrap up today's episode of All the Pieces. I'm very honored to have Mike Poore, our CEO, to come and deliver this message to us. And with that, I can't wait to see you all in the next episode. So take care and brush your hair.
Thanks for joining us for this episode of All the Pieces. Missed a podcast or interested in more information about any of our topics? Visit Connected to access the resources you need to be informed. Interested in having us cover a specific topic or giving us feedback? Send us an email at myepic@mymlc.com. We'd love to hear from you.